morning, everyone. Yesterday, I talked about the last Conservative motion to create a committee to look into the WE scandal, right? And the Liberals made that into a confidence vote to force the NDP to vote against creating that committee, thereby voting against investigating WE, right? And now the Conservatives are reintroducing, they want to look at the spending over COVID, and that includes WE. Right? Everybody knows that includes we. Maybe the Liberals don't, but it does include we. And so here's Brian Lilley. He says, yep, now Justin Trudeau and the Liberals are hinting that a motion on the Health Committee studying COVID and health could lead to an election showdown. He really doesn't want to answer any questions. So this was 16 hours ago. And then 17 hours ago, here's the Liberal on the panel, Power and Politics panel, Power Play, not Power and Politics. And, Liberal MP Varini says the disclosures that the opposition are seeking on vaccines and PPE would jeopardize access. Here we go.
Things that Mr. Davies and Ms. Rempel-Garner want, which was an adequate response in terms of PPE vaccine development.
Why? Can you just explain that? Can you just explain that to our viewers? Why would disclosure jeopardize that?
Because what they are asking for is proactive disclosure of our procurement negotiations with third parties that relate to vaccines and public and personal protective equipment. If we were engaged with a discussion with Novartis about a vaccine, for example, Novartis is not likely going to be willing to disclose that private, confidential commercial information.
So the short version of this argument is, if we disclose what you want, it's going to jeopardize the access to the products that we're trying to buy. And I don't know. So are they willing to make another confidence motion over this next question that the Conservatives want to ask? And Brian Platt is saying 2 sources confirm, as Evan Solomon reported, the second Tory motion won't be deemed a confidence matter by the Liberals. NDP and Bloc are both supporting it, so it appears destined to pass. So they're not going to make this one into a confidence motion, and so it might pass. This is interesting. I don't know. This is an exchange on the floor of the House of Commons. I'm going to show it all to you. Miss Rempel is the shadow health minister. She's trying to hold Miss Haydu to account for essentially the same stuff. And Miss Haydu says that not once has a Canadian asked me to put more resources into freedom of information officers. Here's the question and answer. You'll understand the context in just a second. Here we go.
The Honourable Member for Calgary Nose Hill.
Mr. Speaker, it's this incompetence that's costing Canadians their lives. It's these excuses that are keeping businesses shut. It's this just lack of disregard for Canadians' lives, our plan forward, that is keeping women out of the workforce because daycares are closed, because we don't have rapid tests. This has to stop. The motion that we have before Parliament today is nonpartisan. It's getting information that Canadians need so that we can move forward out of this pandemic. What timeline is the minister proposing to produce these documents?
Honourable Minister.
I've spoken to hundreds, if not thousands, of Canadians since the pandemic was first announced, and in fact when the COVID-19 has arrived on our shores. And in fact, not once has a Canadian asked me to put more resources into freedom of information officers. In fact, what they've asked me for is to ensure that all the resources of Canada are devoted on one thing, Mr. Speaker, and that's the health, safety, and economic prosperity of our country. And Mr. Speaker, we're going to continue to make sure that Canada has the most robust response possible.
Most expensive, worst result. Highest unemployment in the G7. Speaks for itself, Ms. Haydu. I think that it's interesting. The motion is to get documents. The documents depend on freedom of information. Here's a tweet responding to this. It says, for the record, we were in court dealing with this issue. We filed freedom of information for our federal court case, and the government said they needed 8 years to respond. Incompetent, right? It's wild. Here's why. Here's why. Dylan Robertson says, Scoop, less than half of the federal freedom of information offices are operating at full capacity. It's interesting, just very quickly, the Trudeau Liberals won't fund the accounting. Oh, what's the name? The AG, the Auditor General. The accounting guy, right? No new money, says Pierre Poilievre. No new money for the Auditor General, but $15 million in new money for Chrystia Freeland's office, right? So no money for people to hold our spending accountable. And we'll get to that in just a minute. But certainly you can't have freedom of information offices open in the time of COVID-19. But everybody gets full pay? Yikes. Yikes. That's what we're doing, though. Most expensive, worst result. Highest unemployment in the G7. Okay, here it is. Less than half of the federal Freedom of Information offices are operating at full capacity. At the start of the pandemic, 68% of departments deemed Canada's freedom of information non-essential, putting ATIP staff at the back of the line for at-home internet and return to office. Yeah, so they're not seen as a critical service, and therefore they are not producing documents. Isn't that interesting, right? Like, you'd think that would be something that would be seen as important, but not in the age of COVID-19. In the age of COVID-19, nothing is important except spending that money as fast as possible and with as little oversight as possible, including the ability to ask for, receipts and documentation of what the spending is about after the fact, because it'll take, a long time. And nobody's concerned about this. Nobody's concerned about this. Nobody in the leadership is concerned about this anyway. And the NDP don't seem to care. So interesting, right? National Post is reporting. John Ivison, this is an opinion piece. At least Canadians now know that Trudeau's priorities don't include them. Reason returned to Parliament Hill as the Liberals made clear they will not regard a new Conservative motion on Canada's pandemic response to be a matter of confidence. The Trudeau Liberals have wisely decided not to tax the patience of voters who have no interest in an election over procedural issues like Opposition Day motions. I would disagree. I would say that there's interest in trying to hold Trudeau accountable. I would say that there's interest in having him run an election on his laughable, ridiculous record. Sure, let's hear Chrystia Freeland's plan for the future. Could we have a budget, please? No? Scrolling down. So I disagree with that statement. Scrolling down. After making the vote on Friday on a fairly routine Opposition Day motion a matter of confidence that could have sparked a general election, the Liberals have concluded they overreached on a fairly routine. The Conservatives tabled another motion in the House of Commons on Thursday, this time aimed at investigating the government's response to the health issues raised by COVID-19, rapid testing, vaccine deployment, the availability of PPE, and the cancellation of the pandemic early warning system. Conservative health critic Michelle Rempel-Garner said the language in the motion is nonpartisan, that it is supported by the other opposition parties, and that it is Parliament's role to see what's working and what's not. The motion calls for records from Minister's Office and government departments to be delivered within 15 days, but only after they have been vetted by the Commons law clerk on privacy and national security grounds. That says redactions, just in case you didn't know. It is the kind of request that has had the government House Leader Pablo Rodriguez frothing at the mouth earlier in the week when he talked about the previous motion on an anti-corruption committee, what he called a dangerous partisan plan to paralyze the government. Paralyze the government. They've got those words, right? Everybody's got the talking point. They're going to use paralyze as their word. Where does it end? Where does it end? He bewailed. We can't let the Conservatives force public servants to step away from the crucial role they're playing in this pandemic, spending money, to go searching for documents to simply satisfy the purely partisan agenda of the opposition. So asking about the spent money that is our money, the tax money that has been spent, and asking about, accountability for that money is beyond the pale, and public servants shouldn't be distracted from focusing on listening to what Trudeau wants them to do, spend more money in order to justify the already spent money. Sorry, maybe that was too much money. It just seems like partisan politics, like he's playing partisan politics, but of course he is, right? Like, of course he is. Back to the article. And do we really want a committee that has the power to force the Prime Minister, the Deputy Prime Minister, all ministers to drop the work, the important work they're doing, and come testify? The last time Trudeau testified, he was there for like an hour and a half, right? He doesn't have an hour and a half. He doesn't have an hour and a half to go through and answer questions about the millions of dollars that he got from We and the billion that he gave to them, or the 912 million reassigned or revised it down to 512 million for some weird reason. I'm not sure. Just in the middle of the story, instead of 912 million, they only got 512 million. I thought that was funny. But you don't have an hour and a half, sir? You can't come in and talk about the way you've been leading and defend your spending? My goodness. It's not a lot to ask, really. And, there's no RCMP or anything like that there. You've taken care of that, right? Anyway, back to this. But if they realized if they deem the Health Committee inquiry to be a matter of confidence, they may as well lock the doors of the House of Commons. Kevin Lamoureux, a parliamentary secretary at the House, to the House Leader, said that if the Conservative motion passes, the government will do everything it can to respond, even if getting all the documents within 15 days will be physically impossible. Because, freedom of information not needed, blah, blah, blah. So how could they possibly ask a reduced staff to do that? And they're going to talk about capacity in exactly the same way they're talking about capacity in the COVID cases. I'll show you that in a little while. Back to this. The temporary reprieve from a general election will be greeted with a sigh of relief, not just from the millions of Canadians who've got more meaningful things to do, but also by Canada's chief electoral officer. This is priming the pump for you to just say, oh, well, I guess we don't get to hold them accountable. I guess it's okay that the NDP voted down a motion to look into the corrupt wee spending. That's like, nobody wants an election to the point of, oh, big sigh of relief, everyone. Yay, let's all have a sigh of relief together. Where's the outrage over the dodging of the responsibility of holding the people who spent this money accountable for it, right? The people who improperly spent this money, the people who sold the kids the summer job program short in favor of giving money to a company that has given money to the Prime Minister's family and the former finance minister's family and himself. Like, this is unbelievable revisionist history by the National Post in order to get every Canadian to just be like, oh, I guess it's fine. I guess we'll just not have an election. Same with the Toronto Star, right? Hey, Ottawa, there's a pandemic. No one cares about your silly political games right now. The reason Justin Trudeau played that game was to avoid accountability. The Toronto Star. And you should be holding him accountable for that. You should be saying, hey, everyone, we should be holding accountable Justin Trudeau's improper spending on we. It's not appropriate that a company that paid him millions of dollars got $1 billion over top of the summer jobs program. That's your job. Your job, not mine. Here, back to the National Post. A successful election could be held, he said, the electoral officer, if the government chooses a longer election period up to 7 weeks and holds a vote over a weekend instead of the traditional Monday polling day. But Perot conceded that in the event of a lockdown, of local lockdowns, the writ could be withdrawn, leaving ridings hit by the pandemic without representation. There's a silver lining to all this. Justin Trudeau has at least helped many more Canadians to understand that their concerns come a distant third in his list of priorities. And National Post, it's really shown that newspapers are much more interested in serving their biggest customer, the government of Canada, than everyday Canadians, right? And you guys are regularly abdicating your responsibility. It's really just awful. This is Power in Politics. This is 15 hours ago. This is talking about exactly the same stuff. Will this be a confidence or won't it? Looks like this is an hour ago. An hour ago when I started this. So 9 a.m. I think it was updated. But basically, it's not going to be a confidence vote, and it looks like it's going to pass. So something is going to be investigated. But you better believe they're going to filibuster. If they're not going to give out any information they don't want to give out. They would rather go to an election, and O'Toole and Jagmeet Singh and to a lesser extent, Yves Francois Blanchet. Although I think when the chips are down, I think Blanchet is signaling that he would support O'Toole in bringing down the government. But I think when the chips are down, I think he'd have a meeting with Trudeau and he'd see things differently. I think that if Trudeau loses NDP support, he's got an option with Blanchet. And Blanchet is an opportunist. This is politics. Understand this is politics. Yes, I knew that the confidence vote either wouldn't happen or would pass with the NDP supporting. Why? Because they can't afford an election. And everybody has made that point since. Everybody understands that the NDP are completely and utterly at the mercy of Justin Trudeau. And if they go to an election right now, they would probably lose a lot of seats to Justin Trudeau, giving him a majority, and that's not better. So, yeah, I don't know. But there wasn't a surprise for me that there wasn't a snap election called. And I said that on my show beforehand. So, what's going to happen here? Are we going to have to ride out another 3 years of just this rampant spending? Maybe. Who knows? Unless Justin Trudeau gets removed from office somehow. Either steps down or he's removed by his party. That's how it works here. And then Freeland steps in, and Freeland doesn't win. Freeland doesn't win an election. But O'Toole is the same LibCon stuff. He's going to do exactly the same thing, like exactly the same thing that Justin Trudeau is doing. And the transparency, do you remember how transparent Stephen Harper was? Seems like a dream now, right? Seems like by comparison to Justin Trudeau's government that the Harper government seemed more open. But do you think that O'Toole is going to be more open than they were when under Harper? Nope. And they'll do exactly the same as Justin Trudeau is doing now, and they will block people, and then a Liberal will come in and say, oh, we can do better. We can be transparent and open like Justin Trudeau used to be or said he would, but we'll actually do it. It's garbage. Okay, long-term care, getting into Ontario. This is an interesting one. I think this is very, very interesting to I think that there's a big story here, but I think this big story is just going to be eclipsed by the complete shattering of the economy, because the longer the lockdowns go on, and the major, like 43% of Ontario's population is under lockdown, with restaurants, bars, nightclubs, major parts of the economy, right? Like, restaurateurs are not a small impact. They create lots of jobs. Communities are built around restaurants, trivia nights, all that stuff. It's not a small deal. And having this locked down for so long and pretending that cases are the only thing that matter is very, very, very damaging to the province. So I think this is a big story. That is a bigger story that will eclipse this in the long term. But, I could be wrong. Anyway, Dr. Vivian Stamatopoulos, she's Greek. She says, wow, I'm really disappointed that the OLTCA News, so the Ontario Long-Term Care Association News, has blocked me. I've been working for months to secure transparency and accountability for long-term care families. This move establishes a pattern of just what I've been fighting against. And they respond and say, this was done in error and should not have happened. We sincerely apologize for any misunderstanding this may have caused. We welcome welcome respectful dialogue, especially with our residents and families, and are keenly aware of the importance of residents and family engagement. I'm interested how many people have been blocked who don't have the standing of Dr. Stamatopoulos, right? She's got a public platform, and she's obviously, being a doctor, elevated, especially in COVID times, right? And so when long-term care blocked her, she had a platform to say, hey, what the heck? I've been fighting for you. I've been fighting for transparency and all of that other stuff. Why are you blocking me? So doing that shows a pattern of blocking people. So how many people have been blocked by this group improperly? Maybe you shouldn't have been blocked, who should have had their voices heard, but instead were blocked by them. It's a problem, right? Here's our Windsor staying in the long-term care. Doug Ford's government is making it almost impossible to sue long-term care homes. Good thing he's protecting COVID victims' families. Doug Ford made a guarantee is what he did. Quote, I will not stop until these families get justice. Ontario's premier said Thursday on long-term care homes. Simple as that. That's what's going to happen. They will get justice. It sounded good. Nearly 2,000 people have died as COVID-19 roared through Ontario's long-term care homes. British Columbia, with a little less than a third of the population, has had less than 10% of the deaths. Someone has to be responsible. I'm protecting the people, said Ford. I'm protecting the people that lost loved ones. Except he was being asked about including long-term care homes in Ontario's liability shield law, which is part of the province's Bill 218, supporting Ontario's Recovery and Municipal Elections Act. British Columbia didn't include LTCs in its version of the legislation. Ontario did. Ford said he asked if people could still sue long-term care homes and was told yes. Maybe he didn't ask a follow-up, or maybe he didn't want anyone else to. When the Premier says this is not about protecting negligent long-term care homes operators, that's all it's about, says Graham Webb, a lawyer who has tried many cases against long-term care homes and the executive director of the Advocacy Center for the Elderly. So be aware, he's litigated, but he's also executive director of a group, right, advocating Center for the Elderly. Okay. Quote, because long-term care home operators who weren't negligent would have no civil liability whatsoever. You don't need to be a lawyer to figure out that the intent of this thing is to bar lawsuits, said Dr. Amir Atran, a professor of law and epidemiology at the University of Ottawa. That's kind of all it's for. Both Webb and Atran point to the high bar to lawsuits set out in the Act. One is that you have to prove that the target of a lawsuit did not act or make a good faith effort to act in accordance with public health guidance. And beyond that, you can't just prove negligence, you have to prove gross negligence. Just getting over that negligence bar is like winning a medal at the Olympics, says Webb. He tells a story of an Italian-speaking client in an English-speaking home pre-pandemic. He complained in Italian of pain in his leg. His daughter-in-law informed the home. For 3 days, nothing was done. When she called an ambulance, they found his broken femur poking through his skin. He was taken to the hospital and never came back. Even then, there was no lawsuit because the family would have been liable for costs, and negligence was a high bar. They couldn't take the chance. If they had vast financial means, they probably would be in another facility, said Webb. We're not talking about Bronfman's here. The homes have insurance and are really well funded and will defend. So it's already like Main Street versus Bay Street here. The Act, and Main Street is supposed to be the common man, and Bay Street is supposed to be the rich guys, right? The Act also retroactively wipes out existing COVID long-term care lawsuits and creates something close to an unclimbable mountain, a high and uncertain standard of negligence and proof that an action was done with something more than malfeasance. Everyone can say, well, we were working in good faith, but things happened, says Dr. Samir Sinha, the director of geriatrics at Mount Sinai and the University Health Network. This is like when you have to prove Elizabeth Wetlaufer, the nurse who murdered 8 long-term care residents between 2006 and 2007 in Woodstock, Ontario. I think she's alluding to trying to prove that she had murderous intent, but it doesn't really finish the thought. But regardless, I get what the article is trying to say. Here's the other side of the coin. The reason for this is, I think that the reason for this law is in this article, and I'm going to read this article. I'll read the reason that I think it is here. An associate representing long-term care homes has said that they're having troubles renewing their insurance because they're liable to be sued for exposing residents to COVID-19. So Doug's in kind of a catch-22. If he allows the care homes to be sued, then he's going to allow the insurance rates to be astronomically high because they're going to have to be on the hook for the lawsuits too, right? If you insure somebody, potentially, they go to the insurance to get their payouts, right? And so here's what's happening with the insurance. So your rates go up, right? Like that's the problem. So here's Doug Ford on the rates going up, and so that's potentially what's going on here. But Huffington Post, Doug Ford whips out cream metaphor in rant about insurance companies. I'm picturing a coffee table book with Doug Ford and like some of these metaphors just pasted, like just pictures of Doug Ford and different weird metaphors that he's used. Why does this video keep popping up? It's maddening. Okay, whipped cream metaphor. Here we go. Ontario Premier Doug Ford unleashed a figurative food fight with the insurance industry Thursday. I'm fed up with these guys. They have made a fortune over all these years, he said during his daily press briefing. They're absolutely just refusing to insure people. We don't play that game. You guys don't need to get all the cream and gravy and the whipped cream and just slow off everything else and say we aren't going to insure it. He said he's heard stories of insurance companies refusing to insure shops and banquet halls. Since the COVID-19 pandemic began, some businesses have sued insurance companies for refusing to pay out claims related to government-ordered shutdowns. Rates are also rising for some companies like gyms and restaurants because the cost of insurance is based on the policyholder's risk exposure, says lawyer Scott Harley. No, I've got that wrong, Scott. I'm just going to call you lawyer Scott from right now. Told the Canadian press. But the one MPP said the insurance issues came along before the pandemic. Independent MPP Jim Wilson asked the government Wednesday about skyrocketing insurance rates in his riding of Simcoe Grey. In the case of the Greenbrier community in Alliston, they saw modest annual rate increases in the period leading up to 2018. Then out of nowhere and with no claims, they were shocked to learn their premium doubling to almost $16,000 in 2019. Wilson said during the question period at Queen's Park. Incredibly, it doubled again in 2020 to almost $30,000. Now, as a new year approaches, Greenbrier is looking at another potential doubling to $60,000, and that's if they can get insurance at all. He called the insurance industry's conduct near criminal and asked if the government would bring in more regulation on policy pricing. He also said the government's new proposed law, Bill 218, which protects businesses from lawsuits related to COVID-19 exposures, will address one of the factors that's affecting the insurance industry. And then it says an association representing long-term care homes has said homes are having trouble renewing their insurance because they're liable to be sued for exposing residents to COVID-19. Ford said Thursday he's heard about insurance companies just refusing to insure stores and banquet halls. I can assure you the people are the priority, he said, not the big insurance companies making gazillions of dollars. And I thought it was worth pointing out, here's the Greenbrier Community Center, and this one was sad, right? Like these guys have a nice community center, and they've got like bingo on Wednesdays and bridge, and my dad goes to play bridge, not at this place, but at the community center, and he really enjoyed that. That was a good way to connect with people. He looked forward to it every week. He would go out. I asked him to go to lunch. He was like, "Oh, I got bridge." I was like, "Okay, have fun. We'll see you later," right? Like no problem, right? But that's done. And these guys can't open because the insurance is astronomically expensive. They can't possibly insure everybody. So once again, the collateral damage of COVID-19 is astronomical. And is it worth paying the price? Is it worth paying the price for this? Here's too many lawsuits from families who lost loved ones to COVID-19 in nursing homes would gum up the legal system, Ontario Attorney General Doug Downey says. Yeah, how dare they gum up our legal system? Those complainers, right? Welcome to Ontario. We're very, very compassionate here, unless you get to the government level. I Misstep after misstep. How long are people going to allow this crap to go on, right? Really. Here's Matt Morris, and he says, no government budget, no accounting of infrastructure spending, no investigation into we charity spending, no control of Prime Minister spending on whims of UNSC seat travel, etc., no control on spending on other countries. How can a modern G7 country be so out of control financially? I agree. Like, every level, I agree. Every level. Hospitals, here's something that I wanted to... How do you... Okay. First, we have, in the hospital in Ontario, 270 people, 74 in ICU, 48 on the ventilator, okay? The graphs are, 700, 800 new cases a day, but the deaths are very low. 3, 9, 9, 9, 7, 3, okay? In the first wave, we had 45 deaths, 55 deaths, 63 deaths, right? Now we've got next to no deaths. And people in the hospital, hospitalizations in ICU, do you see a concerning trend? I don't. I couldn't find out what our capacity was either. I can't find out what capacity, if we've got 270 people in the hospital, okay, and this headline is true, what in the world are we doing? 270 people is capacity? Seriously? CP24 says hospitals, long-term care homes have little room for second wave surge in inquiry hears. And this was October 5th. It's been 3 weeks since, it's been 20 days, 19 days, 18 days since October 5th. Much longer than the 2-week incubation period. Where's the hospitalizations have gone up slowly. I've been watching this very, very closely. We were at 170 3 weeks ago, I guess. So it's taken a long time to build to that 100, but that's capacity. We're dead top. That's it. That's all we've got. Hospitals and long-term care homes are nearly at capacity and won't be able to handle a surge in COVID-19 patients during the second wave of the pandemic, an independent commission has heard. I think this would be my first question to Doug Ford. Sir, have you seen the numbers of people in hospital? Yes. Do you know how many that is? Yes, 270. Okay. Are we at capacity? What is our capacity? Why can't we find that out? Alberta's got that. I would love to hear his response. What the heck is the capacity? Why are these people hearing that we're at capacity when we've got 270 people in the hospital? Back to this. While there are plenty of physical spaces set to handle an influx in patients, which include many field hospitals ready to go, there's no one to staff them. Oh, well, there's tons of nurses that just got laid off in Newmarket. The Ontario Hospital Association told the Long-Term Care COVID-19 Commission earlier this month. That leaves hospitals across the province with only one quick solution, which they have dubbed the dimmer switch, shutting down elective surgeries once again to free up more beds and staff, the association said. Why not just hire people to service why not just hire people? Why not just hire people? We're spending money hand over fist anyway. We got tons of money, right? The commission, which is investigating how the novel virus spread in the long-term care system, isn't open to the public, but transcripts of testimony are posted online days later. The Hospital Association testified on October 5th that the transcript was posted 2 weeks, and then the transcript was posted 2 weeks later. Barbara Collins, the CEO of Humber River Hospital, testified that about 5,000 hospital patients in the province could be transferred to long-term care homes to continue their recovery, but those homes, she said, have no room, partially due to a government rule that limits the use of 3- and 4-bedroom wards, which proved deadly during the first wave of the pandemic. We survived last time, largely because we canceled surgery, Collins told the commission. It's being spoken about as a dimmer switch this time. That option, which led to a backlog of nearly 200,000 surgeries in Ontario, remains the best and potentially only option for hospitals to quickly free up space and staff to handle a rush of COVID-19 patients. There was no rush. There is no rush. Hire some staff. Get the surgeries back online and stop being completely ridiculous. This is provably stupid. This is a stupid response. This is irresponsible. And unless they're looking at some other data that I am not privy to, this is not defensible. This is unbelievable that Doug Ford is standing out there and dealing with insurance industry rather than getting our businesses back up and running. I looked for the capacity. I went to the Contact Us page here, and I thought that maybe it would lead me to the people crunching the data and the numbers. But remember, freedom of information, this is Ontario, not federal, but I guess this isn't a priority. I can't find anything about the capacity. What capacity of how many ventilators we have in Ontario and what percentage 48 people being on a vent represents? Is that 10%? Is that 5%? Is that 100%? Do we have one ventilator left, right? I know Ezra Levent has referenced this number, but I cannot find it. So if you want to put it in the link in the comments, I would love to see it. And I'll report on it tomorrow when I see it just to compare. But if these numbers are true and this headline is true, right? We're at capacity. We can't possibly. I think that there's maybe a switch, like we could have a switch, right? We could hire people. There's lots of other options rather than stopping surgery, right? I just think it's very, very interesting. This is the other part of this. Since the start of the pandemic, Ontario has processed 4 million tests. Ontario is now well on its way to increasing testing capacity to process 68,000 tests a day, of 68,000 tests a day happening, or more than 40,000 tests a day happening every day for the last, I don't know, months now. And this is the result. Why are we allowing the government to lock us down? Why are we wearing masks? I do not get worried about sending my child to school during flu season. Flu kills children much more than COVID kills children. And I'm not a bad person for not worrying about the flu every year. I'm not a bad person for not sending my child wearing a mask to ward off the flu, because that doesn't work. And it's just crazy. It's just crazy, the response that people are tolerating. I don't understand how you can look at the data and the potential harms of masks and continue to blindly allow your loved ones to carry on with that, right? Because it's breaking the rules. Break the rules. My goodness. My goodness. Okay. I've been speaking to people, and I heard people refer to this like it was a conspiracy theory. It's not a conspiracy theory. They're building isolation centers. They're building this. They're building this under the guise of COVID-19. And the PCR cycles are too high. Ontario is cycling up to 37. And 27 is the positive area, I believe. Anything above 27, that's an okay test. 24 is false positive territory, anything above 24. So 27 is still above the false positive territory. But so a test that yields false positives, if you get the test and you have a positive result, and I don't know what the criteria are for going to this isolation center, but it is an isolation center. This is a CBC News. Public Health Agency of Canada considers quarantine centers for Pigeon River, Fort Frances. The Public Health Agency of Canada, this is federal, is seeking input from the private sector into plans to create new federal quarantine and isolation sites across the country, including 2 in northwestern Ontario. The Government of Canada, on its procurement website, said it's looking for a third party to provide housing and care for people who are impacted by COVID-19 and federal quarantine regulations. Federal quarantine regulations. So, it gives me pause. I don't know what they're going to do with this. There are people out there who say they're going to use it for nefarious means. There are people out there who think this is totally above board and it's, the government can do no wrong. I am skeptical of the government's ability to do no wrong. And I'm skeptical of the use of isolation facilities like this, especially in remote rural areas, and especially in light of the fact that this is not how we deal with disease. This is not how historically you would deal with a bad pandemic. You don't change the entire structure of and you don't destroy your economy and change your culture over a bad pandemic. You just don't do that. There's something else going on. And it's beyond the scope of this program to speculate on the something else, but I'm showing you the incompetence. I'm showing you this isn't a conspiracy theory. This is happening, right? Like this is real. This was October 15th. This is happening too. Coronavirus Australia Live. Chaos erupts on the streets of Melbourne. People are not happy with the lockdown restrictions. People are slowly losing their minds. Melbourne has been thrown into chaos this afternoon with disruptions to traffic and violent scuffles. People are not happy. And the police are there to make sure the laws of the land are followed. And if the politicians are saying the laws of the land are these people need to stay in their house for their own safety, this is what you get, right? Like, this is what you get. Is this what you want? It's not what I want. Here's Lars Christensen. Says, according to the Danish newspaper Berlingske, I've said that terribly wrong, 3 science journals have refused to publish the results of the first major scientific investigation investigating the effects of mask use during the COVID-19 pandemic, apparently because the results might not show what is politically correct, meaning that it shows that the masks are not as effective as the government is making us believe that they are. Kavinder Kerr, she's a medical doctor. I reported on Sweden yesterday having the first lockdown in neighborhoods, and here's Kavinder sharing this, and she says, Sweden continues to lead with humanity and science. Its public health removes restrictive COVID-19 recommendations for the elderly, 70 plus, and risk groups due to severe negative impacts on psychological health from self-isolation. So go out and have fun, elderly people, right? Here's what I was talking about before. Chef warns Joe Warmington that Toronto is dying and not from COVID. Yeah, these are the real impacts of the policies, of these improper, not bound by science policies. Toronto is dying, right? It boggles my mind that John Tory is not leading the back to work safely message, tweeted the star of the TV show The Heat and chief judge on Top Chef Canada. The city is dying, wake up. The owner of popular restaurants and upscale grocery stores is clearly frustrated with the latest 28-day COVID-19 lockdown, which forbids indoor dining. McEwen was responding to the Toronto Sun columnist Anthony Furey's heart-wrenching column on elite martial arts Toronto owner Dan Novak suffering through the latest shutdown. Doug Ford needs to lead Ontario back to work safely, McEwen said. McEwen tweeted in response to a News Talk 1010 host Jerry Ager, sorry if I got that wrong, posting the column. Shutdowns are a mistake. Do the right thing and lead the economy back. Bold leadership. Be brave, Doug Ford. What Tory and Ford have done instead is follow the advice of the public health doctors who, with COVID positive numbers spiking, encouraging the measures that have effectively put the already moribund hospitality industry on life support. So, dying industry, nearly dead. I scroll down. The owner of Bymark One Fabricia? And D1 restaurants said it wasn't being taken as seriously as it should be, and prolonged lockdowns will be catastrophic for Canada and specifically for Ontario. Who can blame any of the owners of restaurants who have been singled out during this pandemic when it was them who set the standard of how social distancing and sanitizing can work? Eateries are what helped define a city with most not having anybody contact the coronavirus, COVID-19. They have already proven they can operate alongside the virus instead of run from it. In need of fresh input from people other than doctors, Tory and Ford should accept the virus is not going away and start working on plans to share the world with it before there is no more commerce left. Yeah, you can't destroy your economy. You can't destroy your culture just to ineffectively promise something you can't promise, right? We promise you'll be safe, but not from anything but coronavirus, but you'll be safe from coronavirus, maybe, right? They can't promise safety. Here's concerning issues, right? Global News is reporting fires set at 3 Walmarts in Kitchener and Waterloo. This is on the 22nd. Today's the 23rd. But yeah, three fires, and I think somebody was trying to blame anti-maskers for this. I saw tweets going around about anti-maskers starting fires, and I thought, my goodness, what kind of crazy world are we living in? I know, it's very crazy. Here is corporate welfare. These are just a couple of stories to finish us off. We're going to go to the States too. Corporate welfare is still bad policy, even if it's green. Giving billions of dollars to... Why is Ontario and Ottawa giving $500 million to one of the largest corporations on the planet? I don't know. Why'd they give almost $1 billion to we, right? Can you ask them that question too? Because we all love to hear it, right? U.S. encourages Canada to hit China with sanctions over Uyghurs. Yeah, that's going to go well. That's not going to happen. Sorry. Justin Trudeau can't even ban Huawei, right? He's letting the public servants decide. The public servants who has a brother who used to be the clerk of the Privy Council. Yeah, just whatever public servants, right? Whoever was shuffled around and has a good idea. This, I thought, man, if you don't know what RICO is, okay, here's RICO. Oh, racketeering, right? And racketeering, I've got this highlighted here. But RICO, the RICO Act is the Racketeering, Influenced, and Corrupt Organizations Act is a United States law that provides for extended criminal penalties and a civil cause of action for acts performed as part of an ongoing criminal organization. Okay? And racketeering is a racket, according to the current common and most general definition, is an organized criminal act or activity in which the criminal act or activity is some form of substantial business or a way to earn illegal money either regularly or briefly but repeatedly. A racket is therefore generally a repeated or continuous organized criminal operation or enterprise. Conducting a racket is racketeering. Okay? So RICO targets organizations, right? Easily identifiable organizations, maybe with a big guy at the top, right? And here is Tony Boblinski, and you should watch all of these videos. It's very interesting. He's got some interesting information on Joe and Hunter Biden, and I'm not going to play the whole video, just a little bit here. But yesterday's debate was fun. I thought Trump won, and I think Joe Biden's in a lot of trouble. I think he's in a lot of trouble. I think that they've got enough to have some serious questions for the big guy. Here we go.
He dealt with the Biden family, including Joe Biden. I have also heard that Vice President Biden said on Tuesday that Senator Ron Johnson, the chair of the Senate Homeland Security Committee, should be ashamed for suggesting that Biden family sought to profit from their name. Well, here are the facts I know, and everything I'm saying is corroborated by emails, WhatsApp chats, agreements, documents, and other evidence.
I'll leave it there. It's very interesting. Very interesting, the ththings he said. I think that Biden's in a lot of trouble. So, wow, and I've gotten really long today. I thought I was at 32 minutes, and it was not 32. It was like 38, 37 when I saw 32. All right, well, thanks for watching, everybody. Check out CanadaPoly.com. Check out CanadaReport.co. Check out SpeakingMoistly.co. And have a wonderful, wonderful day.